Hello, this is a presentation on drugs for Parkinson's disease. So what is Parkinson's disease? It is a neurodegenerative disorder of the extrapyramidal system associated with disruption of the neurotransmission in the striatum. So it's characterized by dyskinesias and akinesia. Proper function of the striatum requires a balance between the neurotransmitters of dopamine and acetylcholine. Imbalances between those two um, from the degeneration of neurons that supply dopamine to the striatum. Okay, so that's what causes Parkinson's disease. Cardinal symptoms of Parkinson's include those dyskinesias, which are tremors at rest, rigidity, postural instability, bradykinesia, which is slowed movements and tremors. In addition to motor symptoms, you can have autonomic disturbances, depression, psychosis, and dementia. So what are the therapeutic goals? The ideal treatment that reverses neuronal disintegration or prevents further disintegration does not resist. So then our goal is to improve the patient's ability to carry out their ADLs. Drug selection and doses are determined by the extent to which the PD interferes with work, dressing, eating, bathing, and other activities of daily living. There are two major categories for drug therapy: the dopaminergic agents, which are the most common, and that would be the levodopa, and the anticholinergic agents, which prevent activation of the cholinergic receptors. An example would be the cogentin. So how do you select drugs for initial treatment? For mild symptoms, you can use MAOIs such as selegiline. For more severe symptoms, you would then start the levodopa, which would be combined with the carbidopa or a dopamine agonist. And levodopa is more effective than the dopamine agonist, but long-term use carries a higher risk of the disabling dyskinesias. What do you do for management of the motor fluctuations? Off times can be reduced with dopamine agonists, with the COMT inhibitors, and MAOI inhibitors. What do you give for neuroprotection? There's no drug proven to be neuroprotective at this point. You can get some protection through your MAOIB inhibitors. Dopaminergic agonists have also shown to have some neuroprotective effects, or you can just go ahead and give the levodopa. So we will discuss levodopa. It is only given in combination with carbidopa agents. It's highly effective but does diminish over time, and food does affect absorption, especially high protein meals. It was introduced in the 1960s. It is still the cornerstone of Parkinson's treatment. It's still highly effective and is always combined. There's a gradual wearing off near the end of a dosing interval, and this can be minimized in 3 ways: by shortening the dosing interval based on the half-life, giving a dose that prolongs its half-life, and that's why it's given in combination, or giving a direct-acting dopamine agonist. Adverse effects, one of the main are nausea and vomiting. Giving initial dose with food can help to slow the absorption, and then side effects. And then that's why it's given in combination with the carbidopa or carbidopa products, because that helps with the nausea and vomiting, It's not really known why it helps, but it does. You can have cardiovascular effects, postural hypotension, increased intake of water and salt. There can be psychosis, visual hallucinations, vivid dreams or nightmares, paranoid ideation, and all these can be helped by reducing the dose. You can have central nervous system effects, anxiety, agitation, problems with memory, insomnia, impulse control, and behavioral changes such as gambling, promiscuity, binge eating, and alcohol abuse. You can have the dyskinesias. Some of the dyskinesias can be annoying, some can be debilitating. They usually develop before or soon after optimal levodopa doses are achieved, and they can be managed by reducing the dose, by giving amantadine, or by surgery or electrical stimulation. It can also cause darkened sweat and urine, and can activate malignant melanoma. So it's important to do skin assessments on these patients before it's prescribed. Drug interactions, it can interact with first-generation antipsychotics, with MAOIs, and with other anticholinergic drugs. It can also interact with vitamin B6. And of course, I already mentioned with meals, especially a high-protein meal, so the patients need to spread their proteins out during the day. So when the levodopa is given in combination with carbidopa, this is the most effective therapy. The carbidopa helps to enhance the effects of the levodopa, has no therapeutic effects of its own, but it definitely helps with all the other side effects that are caused by having the levodopa. Disadvantages, it has no effect of its own. Any adverse responses to this are still due to the levodopa. And when it is combined, you can have more movement and psychiatric problems. And this is the end of part 1 of this Parkinson's presentation.